All right, if you're just joining us, you're watching TVC Breakfast, and on this segment we are discussing, it is World Mental Health Day, and we are discussing the implication of all of this and the disorders people have, what level of things, how concerned we should be, and all of that. And we have in the studio a psychologist, Nathaniel Ayodeji, and we also have a consultant psychiatrist, Dr. Funmilayo Akinola. We've been talking about this. Now, you asked the question to both of them.
So that patients will know where to go to at what point if they have issues. Please, madam.
Okay, like a psychiatrist is basically a doctor first, a medical doctor. So you do your specialization. So psychiatry really is not only about treatment when there is a disorder already. We talk about maintaining good mental health, like I just talked about. Because medicine has to do with prevention. So we do health talks, do this, don't do this. So we do prevention, early identification, okay, early referral to the appropriate place, early treatment, and of course you reduce disability. So it encompasses everything. So we only don't deal with, of course, that's abnormal mind before, if it happens, to treat, to manage, to prevent disability. So it encompasses everything. All right. So, and of course, medication will come in and all that.
So where do you come in?
Yeah. Well, I follow as a psychologist. Basically, don't use drug. We just talk therapy. Now, where we come in most important is to help people to adjust appropriately to societies and also situations around them, helping people to develop appropriate coping skills. Now, for instance, before the advent of mental illness, before breakdown, you as a whole, you are a product of a family and a society, and there are certain expectations from you as you relate with your neighbors, environment, and as you also work and cope. Now, you need your mind and to actually exercise the right appropriate behaviors to cope and also to...
So if we're looking at the theme for this year, taking mental health as your first aid, who should we visit first? Your shop or her hospital?
Both are also promoting mental health and psychological well-being. But at the point of distress...
Making it the first aid, who should we visit first?
Both are important. For instance, if actually it has not been, the cases have not actually been too stressful, or that you need a psychologist first. Then at a point where we know that this actually has actually go beyond that, then there will be a part of referral. Even when you meet a psychologist, a psychiatrist, you still need a psychologist to help you adjust appropriately to society, because there are situations around you that you could not really appropriately manage. For instance, a psychologist helps you to discover yourself. When there is, poor understanding of self, there will be poor understanding of management of self and relations with others. So even though you are taking medications and there's an improvement, you still need understanding of yourself so that you can actually cope better.
There's a story we're going to take now, but I'm forced to ask you this question before that story. How do people really patronize you in this part of the divide? How many people really go to the psychologist? I have never been to a psychologist. I have never been. So do you get referrals?
Yeah. Psychology is not limited to issues of mental health. Psychology cuts across human life events. It's not about just mental illness. It goes about work, environment, family. It goes about belief system, many other things.
Yeah, but so how aware are Nigerians when it comes to sometimes you need some advice, you need somebody to talk to, you need someone to just help you out. How aware are Nigerians? For instance, I was talking about being busy. She mentioned the concept of traffic and all of that, and your head is jammed with a lot of things, and then maybe on the Friday you decide I think I need someone to talk to. Maybe someone just had a heartbreak or something, because these things are very common, very societal. So how many Nigerians come to say, okay, I need to visit as a psychologist to really talk me down, to calm me down?
Yeah, that's been a challenge also for our profession. But I believe there's changes. That's why I know people have confined psychologists, especially understand the role of psychology and psychiatry. And that's why we are coming up from Mental Health Foundations and Emotional Development Academy, where we can provide services to the people beyond the fold of a clinic.
All right, let me ask Dr. Akinola the same question. Are Nigerians really aware? Do they come sometimes without having any issue, just coming to check, to have that counseling? Do they come?
Well, they do come, but usually after we have mental health talks on the media.
Okay.
So when they listen on the TV, on the radio,
they
do
touched.
that. I have some of the symptoms, so they walk in themselves. Of course, the percentage of that is quite low, but it does happen. And so that is why we are advocating, like Mental Health Foundation, to the professionals. And we're trying to bring the patients, even that are having these issues, that we need to advocate and tell. Nigerians really don't know, basically, the difference between a psychologist, a psychiatrist, a counselor. They have counselors. So, but there are different stages. So you come in, you call me, you tell me what you need or what your needs are. I'll say, okay, I can refer you to, because I know what it is. Okay, let me send you to a psychologist. Sometimes they call me, I want to see a psychologist. Doctor, just send me. I said, fine, I will send you, because I know that the psychologist will still send you back to me, But I want to believe that we all work together. We are dealing with human beings, and we all know our limits, what we are trained for. So when I see a patient, most times we see patient doctors, we still send them to the psychologist. But really, we are trained too in some aspects of psychology that we can really advise. The counselors too are there. Then remember that there's still stigma. We're still trying to talk about stigma. So people would rather go to a psychologist
than see a psychiatrist.
Yes, and go to a counselor. But that's not, yes, it's milder. But the issue is that we all know our limits. I need to send this patient to a doctor. So they send us, like, okay, I'll send to a psychologist.
Okay, all right, we'll come back to, I'd like us to talk about the theme for the day, to break it down for us to understand better. But before that, recently, the Chief Judge of Lagos State, Justice Funmilayo Atilade, reiterated the need to replace the Lagos Lunacy Act with the proposed mental health law to address dysfunctional behaviors emanating from mental health issues.
She added that laws equally protecting the citizens and mentally ill persons must be in line with the World Health Organization checklist. On the sidelines, other key players, which included medical and legal experts, said stigma and discrimination against mentally ill persons must be discouraged. Now let's listen to them.
Certainly, a legislation on mental health, presently Lunacy Act of 1958, urgently requires a comprehensive makeover, not simply to get rid of the cobwebs and shed the toga of an antiquated legislation, but to truly address what is the most serious issue underlying many dysfunctional behavior in our society, which, due to gross misunderstanding, receive the wrong or poor attention.
The Lunacy Act is not sufficient enough to cater for the mentally ill, to protect the citizen from the mentally ill, and to ensure their management and their treatment. So today we are trying to talk about what we have been doing in the background and the proposed bill, and how we need all stakeholders to work together and make sure that we get this bill to fruition and get it passed in the soonest time.
In terms of the new legislation, I'm not saying that the proposed new legislation, I'm not saying that is the ideal, okay? But that moves us miles away from where we are at the moment. So the new legislation will definitely be a win-win situation for practitioners in the profession and also for patients. Rights of patients are enshrined in the proposed bill.
All right. We just heard that. Now let's get into the issue of the policies and the laws in here. Stigma. We just mentioned stigma before we even played that report, and they also talked about the issue of stigma. But how bad? Give us a picture, because you are there on the ground. How bad is the issue of stigma when anyone has a mental disorder?
Wow. I think it's as bad as it can get, because it will start right from home. You know that there's something wrong with your child, and because of what people will say, and you know that this might be a mental health issue, but because of what people will say, we rather not go to the appropriate place. So it starts, you know, even the patient themselves, sometimes they start feeling that stigma themselves, because that is the self one now. I don't want to go. If I go to the hospital, they will see me. They will do this. They are discriminated, which is real. I have a patient that the daughter was raped, 18-year-old, in school by, I think, the guard. And by the time they were going to make case that, look, something happened to my daughter, they went to find out that it was a patient. So they were going to use that against him, that they will go to Lagos State Citizen Mediation Center and all that. That is a patient. I said, don't worry. If you need anything, just come and meet us. We will defend you. That you are well. So it's not as if you are hallucinating. It had photographs. It had everything to show. At least your wife doesn't have a mental illness. So they can't say. So you understand? The part to even seeking for help, stigma affects it. Individual, the family. Okay. Even we that we are mental health practitioners, other doctors once here, what's your specialty? Psychiatrist, like, So it's everywhere.
All right, let's bring in Foladele in here to give us perspective of the reaction of Nigerians. Fola, good morning.
Good morning, Mike. Good morning, Busalami. Good morning to our guests.
Yeah.
Now, when you talk about mental health in Nigeria, I mean, of course, people think things can be better and we're going to have a better structure, but worldwide, actually, this issue of mental health has actually been trending and the internet has been buzzing. I'll tell you why in a second, but let me start. The first tweet here from @KBeginsKiss says, don't wait until you have a mental breakdown to start caring for your mental health. All right, next one. And now let me stop for a second and just tell you why I was saying earlier that the internet has been buzzing. Okay. So a certain African-American rapper, Kid Cudi, he actually came out on his Facebook page a few days ago to say that he's been battling anxiety and depression for years and he's never had peace. He's never been happy. Now, he also apologized to his fans, saying, you know, I'm sorry to have let you down and all that. The issue now is the fact that he's African-American. And you know how it tends to get. You know, in Nigeria, we say we don't get to talk about our problems because you have to be macho.
Yeah. And Nathaniel earlier.
Exactly. But it's not only a Nigerian thing, it's actually a black thing, if you would say. And, you know, let's go through the tweets and see what I'm saying better. Matt Newton says, the fact that Kid Cudi felt the need to apologize for depression speaks volumes on how mental health issues are viewed in today's world. Next one from @Blackhaze, who says mental health in the African-American community has to be addressed the right way. Next one here from @Dakari A. Barnes, who says, as black men, we've been taught not to talk about mental illness or express our emotions. Glad we're having this conversation. #you good man. And this was actually one of the outcomes, you would say, or I could say rather, of Kid Cudi coming out to talk about what he's been battling for years. So black man thought, okay, you know what, we never get to talk about our problems. Let's start the #you good man. So basically people get to ask questions and say, you can feel free to talk about what you're going through. It's okay. The fact that you're black doesn't mean you can't be honest about your feelings. Now let's bring it to Nigeria. Folusha was very honest about his feelings and he says, I've been depressed for 2 years. My life literally stopped, but I fixed myself. It would have been easier if I had sought help. So talk to people.
Okay.
Next one from @Carnivore, who says, I think Nigeria is ripe for proper mental health therapists and shrinks.
Nathaniel is here.
Yeah. And the last one here from Darwin, who says, talking to my colleague who is Nigerian, he just said Nigeria has an epidemic of poverty-induced mental health conditions.
That's a big one.
I actually want Nathaniel's reaction to this really quickly before I go. Is a lot of our mental health cases, do you think they're tied to poverty issues?
Or societal issues?
Not really. Mental health, I always said, yeah, poverty is one of the things that are actually proven, but not actually poverty. For instance, managing some clients who actually, not that they have really poor, but because of stigmas and they have issues which actually unresolved and don't know how to go about it. And this pile up within, and the fear of not going to psychiatric hospital, and also the fear of not actually letting it out. Before you know, it tends actually to degenerate into mental illness. Now, this is not because there's money problem or whatever, but now that even results to depressions and the person was actually locked inside for quite years. Now, we cannot say that poverty is actually really caused, but yet poverty is one of those things.
All right, it may be one of the societal issues. Yes. Fola, thank you very much. We'll see you later on. Yes. Okay, we have to end this segment, but let me ask Dr. Akinola just this question. Psychological first aid. Now today, how best is it to commemorate a day like this?
You've asked 2 questions. Okay. So
just briefly.
Yes, psychological first aid. I think what everybody, Federation of Mental Health, World Health Organization, what they're trying to do is that it's not to come to us first, people on the street. Something happens. Crisis is happening all over the world right now. There's natural one, man-made, at large scale, at individual levels. So the people that you get in contact with, everybody should learn how to offer help, support. That's what they're talking about. So this psychological aid, and we're not saying that that is the only thing. It involves social support and referral. So you get there's an accident. It might not be the immediate point of that crisis. It could be a week or 2 later. So what is it? Look at yesterday, of Lagos were flooded. What's going to happen to them? People around them that comes in contact with them, you offer support. Where are you going to sleep today? What about your children? Okay. What are you going to wear? Do you understand? So after that, was anybody injured? Refer to the hospital. After that, so the counseling continues. So where are you going to get a new house? Once the water recedes, are you able to go back into that house? Are you going to get a little bit of cash to clean the place up? So that's a psychological first aid. And of course, you learn to listen. Let them tell you the experience. You don't force them. If they don't want to talk about it, then fine. But there's a listening here, and they know that they have a support. So and anybody can offer that. That those that offer emergency relief services, everybody should learn it. The policeman, even the teachers in school, when something happens to the children, look at America, people go in there, they shoot here and there. So everybody should be aware of the kind of psychological help and support that we can offer at the point of crisis.
All right, Dr. Olufumila Akinola, it's a lot of work, I must say. Consultant psychiatrist.
When it comes to the police now.
It's a whole lot of work.
Yeah. Those are first point of call.
All right, thank you very much, Dr. Akinola. And Nathaniel Ayodeji, thank you for coming on the program.
Thank you.
It's been a pleasure.
Thank you.